Let us discuss about first pass metabolism. First pass, we'll zoom the paper. First pass metabolism. Let's see what is this first pass metabolism. Right, if for suppose you are taking a drug orally. When you take orally, the drug passes to mouth to inner GIT, right? From there it gets absorbed, right? From there it goes to liver, right? From liver it enters into systemic circulation, right? Systemic circulation. This is how drug goes into body. When you give orally, the drug passes first through GIT, right? From GIT it gets absorbed. From there it goes to liver. From liver to systemic circulation, right? If any metabolism takes place in this area from mouth to liver, if there is any metabolism of liver, if there is any metabolism of drug in this area, then that metabolism is called first pass metabolism, right? So simply we can say first pass metabolism as metabolism that takes place before the drug enters into systemic circulation, right? So simply what we can say is the metabolism that takes place before the drug enters into systemic circulation, right? Systemic circulation. Here we can see, right? So after liver, after going into liver, after that it is entering into systemic circulation. So where is that metabolism takes place in? It is taking place in the liver, right? It is taking place in the liver or in the GIT, right? So in these two sites first pass metabolism is taking place. Let's write it. Mostly the sites are GIT and liver, right? These are the most common sites, right? Sometimes even if you give in some other routes, the metabolism can take place in skin also. If you give the drug in transdermal patches, some metabolism will take place in skin, right? If you give transdermally, then some metabolism will take place through skin. And if you give the drug through any route, some metabolism will take place through the lungs, right? So if give parentally, what happens? It goes into blood vessels, from there to lung, from there to heart, from heart to lung, right? Then after lung it goes to systemic circulation, right? So before systemic circulation, the metabolism can take place in liver to some extent, very minimal, right? So the most common sites for first pass metabolism are GIT and lungs, GIT and liver. You remember these two words. And most of these skin and lungs, these are this takes place very minimal involvement. There is very minimal involvement of these organs in first pass metabolism, right? So whenever you are asked for first pass metabolism, you should remember two sites. One is GIT and the second one is liver, right? Now what happens to the drug when there is first pass metabolism, right? Let's see that. The first thing is, if we give drug, if that drug undergoes first pass metabolism, then we have to give higher doses, right? Because by first pass metabolism, some amount of drug is being degraded, right? So we need to add some more some higher doses, right? So there will be higher doses of oral administered drug than parentally administered drug, because if you give it parentally the drug is entering into systemic circulation directly, whereas when you give orally, that drug is undergoing some first pass metabolism, right? So we need to add some extra dose to compensate this first pass metabolism when you give the drug orally. Clear? Now the second point is, right, and moreover this first pass metabolism has got inter-individual variation, right? Inter-individual variation will be there. Individual variation, right? Right, and I told you, right, in first pass metabolism, what are the sites? Mainly liver and, what are the sites? Liver and GIT, right? Liver and GIT. So when there are any diseases in liver, right, when there are any diseases in liver, that means when there is pathology in the liver, then first pass metabolism will be hindered, right? First pass metabolism will be decreased. So when you give drug into such patient orally, then the plasma level of that drug will be increased, right? Because there is less first pass metabolism, right? So the bioavailability of that drug increases. Clear? This is the third point. And the fourth point is, if the two drugs are competing for same sites of first pass metabolism. Okay, if the two drugs are competing for same sites of first pass metabolism, then these two drugs, when given concurrently, then inhibit each other. Okay, when you give these two drugs simultaneously, then these two drugs will inhibit each other. This is about first pass metabolism. Let's revise the things that we have discussed in first pass metabolism. So as I told you, first pass metabolism is the metabolism that takes place before the drug enters into systemic circulation. What are the sites? We have mainly GIT and liver, right? And some metabolism will take place in skin and even in lungs, right? And as I told you, the important sites are GIT and liver. Clear? And what are the important consequences of this first pass metabolism? The first one is the oral dosage of the drug is more compared to parenteral dosage, because the first pass metabolism. The second one is there is inter-individual variation of this first pass metabolism, right? Third one is, if there are any liver pathologies, then the bioavailability of that oral administered drug will increase, right? Fourth one is, if the two drugs are comparing for same sites of first pass metabolism, then those two drugs will inhibit each other. This is about first pass metabolism. Thank you for watching.